fazer aqui o slide e chamava o palco. Bonnie, you'd like to introduce your speakers? Or should I introduce each speaker? I'm introducing him, okay. So, switching now to English. This is very tough for our Reggie, so they have to change the system every time we move. So round of applause for this coming panel. We have here Hélène Guillaume, Carla Rodrigues, Bonnie Clipper. Hélène Guillaume is the founder of Wild.AI, a very successful app, a digital health app, and but I think Hélène, you would explain more her role and her stunning presentation that is already being prepared here in the Regi. If everything is okay to start now, I want to see a thumbs up, okay? Okay, thumbs up. Hélène, the floor is all yours. Welcome to Lagos.
Thank you. Thank you so much for having me in Lagos. I live in Aroeira, very close to Lisbon, so it's a real pleasure to be here and explore a little bit more how the theme of longevity and wellness can be applied in Portugal, because it's such an incredible place to live. People are incredible, and I really think that it's one of the best places in the world to live, which is why I live here. So I am Hélène Guillaume, and my talk today is a little bit different than what I've been doing previously. And it's on biological intelligence. So everyone is talking about artificial intelligence now, and it's scary, it's an opportunity, but there's also the flip side of that, which is what makes us really human. And it's really like an important question today, because we fear what is coming up, but if we really ask a question, what makes us human, that is really the answer to all the fears. That's me, 9 months pregnant, surfing in Portugal. And for me, this is really what makes us human. Like, being human is incredible. And there's nothing that replaces being in a room all together, the energy that we live together, and growing a child, being a parent, and really like this is really what makes us human. And when we talk about this topic of longevity, what is longevity? Is it us living long and better? Or is it the survival of the species which is surviving and is actually now in this question today, because everyone is like, is it the end of the human race because we're going to be taken over by robots? When you are pregnant and you're giving life, I can tell you, you're pretty sure that it's not the end of humanity. So what is AI? AI really is data in, data out. And it's really important to understand that today AI is still pretty much that. And this is what led me to my company. So my background, I'm a data scientist by training. I studied mathematics and financial risk. I was a quant in a hedge fund and a consultant in AI. And I built my company Wild.AI, which is an app for women to eat and train with their hormonal fluctuations. It's very important, the word woman, because it is very different. I will delve into what the company was actually doing. And I sold it in October 2025 to a New York Stock Exchange publicly listed company called Zep Health. I'm also now advising governments and corporates on AI. What is AI? Is it scary? Is it an opportunity? And how can we mix both and make it successful? And my big topic now as well is AI sovereignty in Europe, because Europe really has a unique opportunity today to be the best place in the world to save AI from itself. When you look at the US, they're doing really bad stuff. They're allowing the models to be crazy and to be basically surviving themselves, which is scary. And then we have on the other side, we have Asia, which with big models as well. But in Europe, we really have this opportunity of creating a good and AI that is serving us, because AI is amazing and is not going to destroy humanity, hopefully. So that's my big topic. This is my company. So what we're doing is we're taking data from wearables and manual input, aggregate these two together, gives a female readiness score, and based on that, provide personalized and adaptive recommendation. Why for women? Because women are different. And then we developed from generic data, an API, turned the data into female data. And this is what made us very successful, and we got acquired because we turned any wearable, so all of you who are wearing wearables, they were all for men, and we turned that into female data. And women are changing all the time, and there's this concept that women are complicated, hormonal, moody and bitchy, and the reality is we're just this perfectly fine-tuned machine, but we didn't understand our bodies. And so this is all the life stage that women are going through, from our first periods, menstrual cycles, 40 years, birth control, all different, chronic conditions, PCOS, endometriosis, 10% of women, hysterectomy, removing one or all of the reproductive functions of women, prepartum, how to get pregnant, pregnancy, postpartum, perimenopause, menopause, etc., etc. Egg freezing, IVF. So we have a lot of hormonal fluctuations. It's a lot. But when you look at the AI capabilities today, there's no good reason not to serve women properly. I'll give you some screenshot into what we're doing. So hormonal contraceptives, people generally think it's a box, but actually it's a really strong hormone. Like if you close your eyes now and you think, what is a room full of testosterone? You can imagine a full room of men. If I tell you, close your eyes now and imagine what is a room full of estrogen, it's quite hard. You're like, I don't really know what it means. So estrogen is similar to the male testosterone for men. And if we take artificial ones, it changes our body all the time. So it's really important how to understand that. Crash course, there's 3 big types combined, progestin only, non-hormonal. They change our body depending on how we take them. Hop, hop. Next slide. And then we have, thank you, we have these big hormonal changes, and then we hit perimenopause. So this is 1 to 10 years period before we have our last period, which is 12 months birthday of not having a bleeding, which is called menopause. And during this time of perimenopause, which is starting in late 30s, 40s, and then goes down to like not having any ovulation, menopause and postmenopause, all our metrics are changing all the time. Changing all the time. So we have this big hormonal fluctuation. So again, it's important to understand that, because until now, what we've been told is that women are crazy, you're having hot flashes, open the window, and there's no answer. But there is an answer, because underlying, it's actually data. So understanding data means we can serve women properly, which is really important, because it's not okay to have half of the world population being told they're crazy. Whereas we actually just have data, and if we read the data well, we understand women well. So longevity is a word which is living longer, sure, but living well. And women live less well. The women live less well than men. So we live longer, in average 5 years longer than men, but we live less well. So we have more chronic conditions, we have more pains over time. So how can we change that, and how can we have really embedded in the way we think, in the products we use, in the technologies we develop, this idea that serving everyone is good. So now we're going to the doom stories of the bad AI. What is bad AI? It can happen. So it's quite important to understand that this is not something that is crazy in the long term. Like, it already is happening. In the US, Grok is actually, men can generate pedophile porno. It is not restricted because they say this is free speech. This is not okay. Like, humans always needed rules. We always had jails, because when people are really bad, they go to jail. It's like time out, you're out. And free speech is great, but you cannot insult your neighbor, you cannot do certain things, and it's not okay to generate images just in the name of free speech. So bad AI is also things that are not diverse, like not serving women. And if you use ChatGPT today, the data in is male data. 80% of the medical research today is male data. So ChatGPT is not serving women. So if you have a heart attack as a woman, it doesn't understand what are the symptoms of a heart attack for women. So this is bad AI. But there's a possibility of good AI. So what is good AI? And this is my big new topic now, is like, good AI is, in Europe we can say, hey, we don't want that. This is not okay, this is not good. We want an AI that, first of all, protects our citizens, protects our kids, protects our women, and serves us. And so we are going to put boundaries, and in August 2026, we have the AI EU Act that is coming into place, and we want something that is really serving us really well, because AI is amazing. How can we make it happen for us? Competitive yet safe. So we really are the only place in the world where we have the opportunity to create that. So let's make it happen. And in health is amazing. And history repeats. When we had the big farming revolution, people were thinking like, it's the end. Like, what are we going to do? All people were losing their jobs. Like they were taking out of the farmlands, and they were like, we don't know what to do. This is what is happening now. A lot of people are scared. Like, are we going to lose all our jobs? If you don't know how to use AI, yes. But if you know how to use it, you're going to upskill yourself, because we are humans, and humans is amazing. And remember the picture of me super pregnant? Like, it's incredible. Can we make a human in a plastic box? Not yet. Do we want it? I don't think so. And there is 20 years ago, we had a big cloud revolution. So what is the cloud? So in big corporates, we're like, okay, we have all the data on device, we're going to put it in the cloud, and it's amazing. And we're thinking, okay, that's cool. And now everything is in the cloud, and we're like, okay, it's great. But it was never a cloud. Like, it always was actually big physical warehouses. It was never up there in the cloud. And this is what is happening today. Like, all our data is not in Europe. And information is power. Data is information, AI is data. So if we want to have power, understand, protect our citizens, have a good AI, have a good healthcare services, we need to really think like, oh, how are we going to do that differently? It's not up there, it's actually in the US. Like, more than 50% of the data centers are in the US, in the world. So why does it matter? It really matters because if we know where our data is, we can protect our citizens. Information is power. If it's in our hands, we have the power. We had, once upon a time, food was the power, then oil was the power, and now it's data the power. And what is next? That is where we are in this big revolution right now. It's really exciting. Now it is AI. Thank you. And so biological intelligence, us human, is really, really important. And this is why it's so exciting today, because yes, it's scary, but it's also the power is in our hands. And Portugal is an incredible place because everyone is interested in Portugal. I mean, you've seen the influx of us foreigners because we love this country. And it is an incredible country, and we really have the power to change things. So what do you see here? This is one of the best athletes in the world, Serena Williams, and her coach. Why? Because us humans, we love humans. People love people. We are together because we are really, like, there is something very specific. She's one of the best athletes in the world. She knows the theory, she knows how to play tennis, and probably much better than her coach, by the way. But there is something very special with a human-to-human relationship. There is something very special to having a person, a nurse, taking care of you as a person, as a human, looking at you in the eyes and telling you certain things that the machine could also tell you very differently. But us humans, we love humans. So what is the difference? And we are now in a 3 years window where everything can change. It's amazing, and all of us here are like leaders in our own fields. So this is my invitation for you, like starting with health, because in Portugal we have something very special with the SNS. A lot of our data is digital already. So let's make sure we advance properly health to start with, because there are a few places where we have a lot of data. Health is one, military is another one, sports is another one, but health is amazing. So how do we make it sure that we are the best place in the world to advance that and make things happen very well? Because in 3 years' time, it's going to be too late. Remember the doom story of the bad AI? We don't want that, so how do we make that change? So this is my invitation for all of you to reflect on how do we make it. We are in a sector which is health, longevity, but how do we make it happen so that it really brings forward the country and Europe as well. Thank you very much.
So I don't know how this works. How do you move this? No, how do you move it? You just click? Okay.
Thank you so much, Hélène, for this stunning presentation, as I was expecting, and Carla is going to have not less the same kind of style of presentation as we have previewed also the slides. I hope you're enjoying this seminal session at the end of the day one in the morning. So let me just briefly introduce to you Carla Rodrigues. She's the Strategy and Project Management Director of Ontario Health atHome, a very special organization in Canada that you will be talking more right now. A round of applause for Carla Rodrigues from Canada.
Thank you so much. Well, good afternoon, everyone. Bon dia a todos. Yes, I come from Canada. I lived there in Toronto. But I wasn't born in Canada. I was born and raised in Portugal, in a small town called Guarda. Do any of you know where Guarda is? Oh, yes, wonderful. So for those of you that don't know where Guarda is, or what Guarda really stands for, it is the highest city in all of Portugal. It's a small town, but it's a really wonderful place. So I invite all of you to visit sometime. So yeah, my parents immigrated to Canada. I've lived there since. And my journey today I want to share with you my journey as a patient and as well as a health systems leader, moving from sick care to home care to self-care. But my career didn't actually start in healthcare. I actually started in finance. Actually, my first job, I was a programmer. I worked in technology, computer systems, in large financial banks. And I thought I understood complex systems until one day I became a patient. Shortly after giving birth to my son, he literally broke my body, or what it felt like. It was so much pain, long recovery. I couldn't move from the waist down. So I was hospitalized, and they diagnosed me with severe pelvic bone separation. I was in the hospital for a while. Then when I was discharged home, they said it would take about 3 to 6 months for me to be able to walk again. I went home with supports from the company that I actually work in now. It was named something different at the time, Ontario Health at Home. So we provide supports at home. We work with service providers to provide nursing, to provide therapy, to provide medical equipment in the home. But it wasn't all these services that really helped me get back to walking within a month's time. It was my resilience. It was my ability to stick to those daily exercises, my consistency. Because during my pregnancy, I had voiced many concerns about how I was feeling. So all of this could have been prevented, but it was dismissed. And so I had a long journey of pain in the hospital, long recovery at home. And so this really ignited my passion for healthcare. I'm an engineer, and I thought, wow, there is so much to fix in healthcare. So then I left. So after 10 years of working in finance, I went and worked in healthcare, but not as a patient this time. I went with the clear purpose to redesign the healthcare system. And what I found that was really interesting is that healthcare, and I work a lot with finance now, we fund hospital care, sick care, and we fund home care. There's really nothing around prevention in our system. It's not integrated. We call it it's economically invisible. I know that some countries here, by speaking to some of you today, they've made much progress with prevention. I think Canada still has a long way to go through tax incentives, perhaps. But yeah, it barely exists. It's an invisible cost. But it's not really invisible, right? Because the costs, if you don't prevent it, then you just end up spending it in the hospital and home care. So if we truly want to change the healthcare system, perhaps we might need to look at prevention. And so because of my background in technology, I was able to very quickly get into digital transformation work within the healthcare system. I actually co-authored a paper with many individuals, like healthcare leaders in Ontario, for the expansion of virtual urgent care in Ontario. We looked at 22,000 visits over the course of, I think it was 9 to 10 months worth of data. And in this study, it was incredible for us to understand and learn the importance of equity. Because when we rolled this out, it was the younger generations, it was the educated, it was the tech-savvy people that utilized the system, not those that we actually wanted to reach. We wanted to reach the remote communities in North Ontario. So as you know, Canada is a very large country, very vast. Ontario alone can fit 11 Portugals, very vast. And the majority of the people, they live in Toronto, they live in Ottawa, but there's still a percentage of individuals that live across the rest of Ontario, and they don't have that access to care. And so virtual care really creates an opportunity for us to provide the care in these remote areas. So restoring equity is very important. Another piece of work that we did, so I worked in 3 very large hospital systems in 3 different cities. And in one of the communities of these hospitals, we were supporting over 150 languages and dialects, very, very diverse. And so we created this tool. We partnered with a solution, which was for medical live interpretation. It was accessible through bedside terminals. It was accessible through the emergency department, through urgent cares. It was everywhere. And what was really interesting about this is the ability for patients to then communicate with their clinical teams in their preferred language, in the language they worry in. This was important because then you don't rely anymore on family members to translate complex medical conditions. Understanding is essential. It's dignity. And in a hospital setting, it's safety. So really proud of doing that work. Another piece of work that I was very proud of, and maybe it doesn't sound very big because digital access to care is almost everywhere. Patients have access to it. But with changing generation, we wanted to actually expand or be able to provide digital access to patients that were like young adolescents, the age of 14. This required some significant change in policy, but also we provided medical access, digital access to their records for mental health patients. Historically, due to the risks associated with these populations, we were not providing access to their digital records. But this provided the ability to, for equity for sure, but transparency, and it provided the opportunity for these underserved communities to have agency in the system. And so working in home care, I'm learning a lot about the community and the challenges that we're facing. And it sounds like these challenges, they're not really unique to Canada. I hear, just from speaking with some of you, these are global challenges. Aging population, increased medical complexity. There's many individuals, and I heard it today, isolation, multiple comorbidities, living alone, having issues with transportation, because as you transfer from one care setting to another, some individuals have issues with transportation. We also have significant workforce shortages. We have a lot of physicians and nurses that will travel to the USA because they're better paid. They have better access to research. So we do have that challenge. And long wait times. So in Canada, it is a public system, all in all. There's very few, I think, dental health is through insurance, but the majority of it is all publicly funded. And so there's long wait times, fixed budgets, yet patient needs continue to evolve. So working in home care and with the community, it was really important for us to bring technology closer to home. So we are looking at, we're exploring opportunities in predictive AI for things like wound care management. So wound care management, like pressure injuries, things like that, the ability to now be able to take a picture of the tissue, send it to your clinician, and then the clinician will be able to see if there's any markers for infection, if there's risk of deterioration. Like, it's amazing, like the ability to now predict the risk and intervene sooner. We also expand programs around remote monitoring. So remote monitoring is, individual goes home, patient goes home with a set of tools to manage their oxygen saturation, heart rate, etc. But what's key is actually having a model of care that supports this. So you have registered nurses that are monitoring how patients are doing and then be able to intervene, change medications well before the individual actually needs to go into a care setting. So it's really transforming the way we're providing care. We continue to look at integrated models of care, so integrating care with primary care, so working with family doctors, working with social services to really provide bundled services around the patient so that we can keep them healthier in the community so that they don't go into the hospital. From a smart workforce perspective, so with the challenges in the community, we are actually looking at geospatial intelligence and some analytics to be able to more effectively assign workforce to different locations so that as patients are moving through caseloads, that we're able to provide and effectively utilize the resources that we have in our communities much more effectively. So geospatial intelligence is really helping us with that. So I've shared with you my journey from working in a hospital, working in home care, but now I'm going to share with you a bit of my personal journey and maybe my destination, which is through self-care. So this is me and my son. I did not look like this a year ago. I looked very different. This started as a family-friendly competition using a wellness app. It was amazing. It really changed the way. So like across Canada, we have family all over Canada, and all of us have to enter in like our daily activities, and we have goals that we are meeting. And what's interesting here is we have all this data. So we're data rich, but it's not the data that's actually moving us. It's the connection. It's the fact that I don't want to be in any family gathering that I've been eliminated from the competition. So it helps me connect to this. This has really changed our ability to commit to our health. Because if we truly want to fix the healthcare system, if we want to create health, then that's the model. It is working on prevention. Because if people move more, if they eat better, if they sleep better, then they can delay those hospital visits. They can delay that long recovery at home. But how do we turn prevention into a health system transformation driver? We don't do it today. So right now in Canada, prevention it's a consumer tool. It is not well integrated into the healthcare system. But some of the ways that we could perhaps start bridging the gap is perhaps by measuring it. And we already do that to a certain extent. I mentioned earlier about measuring the risks. So now we're not following the illness, we're measuring the risk to have the illness so we could prevent it. Integrating prevention. So if we measure it, and if we prevent it, or we integrate it, so integrating all that rich data that we can get through Wealth Apps, integrating it into clinical workflows. So then again, it's not, it becomes less of a consumer tool and activity and more of a clinical strategy because it's now connected to primary care systems, to hospital systems. Lastly, it's about valuing. So how do you create the value? How do you show value for avoiding illness? Well, in home and community care, I spent a lot of time looking at system utilization, like a lot. We're always looking for ways of how to not reduce the care, but make it more effectively, efficiently, more cost effective. So if we can show that prevention is actually reducing health system utilization, then we can make prevention visible. So if we can measure it, if we can integrate it, and if we can create a financial model around it, then I believe we can create prevention to be a driver in health system transformation. And so I do believe that the future of health, well-being, and longevity does belong to making prevention visible. If we measure it, if we can integrate it, and if we can design a funding model around it, then I absolutely think that we can move forward and be able to restore the trust that we have in the healthcare system. Thank you so much.
Thank you so much, Carla. Wow, what a morning. 2 keynotes, assembly, and these closing keynotes in the morning. Wow, we accomplished in this half day what I was expecting for the whole summit. But the best is still to come. The best is still to come. I'm going to introduce you now to a fireside chat moderator, Dr. Bonnie Clipper. She's the chair of Digital Health Portugal Advisory Board and a renowned nurse, 22nd top digital voice in digital health in LinkedIn, and a renowned consultant in transformation organizations. Bonnie, thank you so much for being with us. The floor is all yours, and enjoy the conversation, ladies.
Awesome, thank you. Can you all hear us? Okay, thank you. Muito obrigada, Paulo. Eu pratico muito mi português, mas muito mal. It's muito difícil. Thank you all very much. You guys were amazing. So you've given us a lot to think about when we think about how we can use apps, the data it collects, and what it can do for us. And then we think about digital transformation going from hospital care to home care, empowering people to basically manage their own health. When you guys think about that, how do we bring it into this space in this conference? How do we look at ways that we can really integrate a wearable app and the data it contains with the care we have to provide our patients? Let's talk a little bit about the business model, right? Let's talk about the money. This stuff is amazing, yet we have to create a sustainable ecosystem where we can continue this and scale it and get it on more and more patients, people in the community to improve our care. It essentially reduces our costs, hopefully improves longevity and wellness. What business models can you think of, can we talk about today, that help us tie together the wearables into the data, into prevention, to reducing costs for our municipalities, our regions, our hospitals, and our health systems?
Go ahead. Yeah. Interesting about how you spend costs in technology. So working in three large healthcare organizations, we spend a lot of money in technology that doesn't work. So I think it's so important that you have the right individuals at the table that help you design the right systems, and having the engagement with clinicians can go a long way. So for instance, in Canada, when we worked on the virtual urgent care to reach these communities or these remote communities, we didn't actually talk to the indigenous people and the first Inuit individuals. Like, we didn't think about that. But now it's like the forefront of like, how do we engage them? How do we co-design? And co-design, it's not just like a checkbox of engagement. Co-design is shared decision-making. How do you work together with the individuals that are going to be using these tools and redesigning it in such a way that it is going to create value? Because once it creates value, then you can have supports, right? But it's so important to do that like right from the beginning, like designing the right tool that can address the needs of clinicians as well as patients in the community? Yeah.
Yeah, business model is a very good question. So when I was running Wild.AI, a big issue we had is that we looked at the revenues very late. So if any of you is using Strava, Strava was a free app until COVID, and then they changed the model and made people pay for it. And until 4 years ago, apps with a lot of data were valuable. Now apps that make money are valuable. So making money is very important. And it's very important also to look that different countries have different ways of being able to make money. So the US model is, like the insurance model is very different because primary care, like health, public health, is pretty much non-existent. And so it's really, really expensive. So the private care system is very important. So for them to, like they're pitching each of themselves into corporates and they're like, hey, I am better than this other insurer because this is what I provide. And this is why we see in the US models like MediHealth, which is now $1 billion company, which is an app for women throughout their midlife, from like 30s up to menopause. And it works really well in the US because they sell themselves to insurers. In Europe, it's a little bit different because our public system is actually really good. So good that actually when you give birth, for instance, you probably go in the public system. And if you have an issue, you definitely go in the public system because it's much better than the private clinics. So in Europe, making money as a preventative solution or an app like mine, Wild.AI, which is across prevention, longevity, and sports, is actually very different because people have great stuff free, basically. So we need to think of like what else would people pay for? And also our behavior in Europe is very different. Like UK would be quite similar to US. Canada is actually not super similar to the US in terms of certain behaviors. But like, for instance, the sports behavior in the US is very different. People are obsessed with gyms. Here in Portugal, we live quite well. Like in the morning, we have a coffee this size, whereas in the US, we have a coffee like this size, or like, a pint of milk. So obviously, like when you drink that for breakfast, like you need to go to the gym. And when a salad is like that size in the US, here we have a fish, we have like, vegetables and 1 or 2 potatoes. This is like our lunch in a normal like taqueria. It's like super healthy how we eat here. So obviously like our issues are very different. Prevention here is different. But then also we still age not really well. And so like what you were saying, like how can we, like the education aspect is very important. And that goes from very, very young age. So like I have 2 very young kids, you might see them running around. For them, like we try to make having an apple super exciting. It's like if you're good, you can have an apple. It's amazing. But then obviously they have some noise and there are some other people and it's like, oh, if you're doing great stuff, you're gonna have a cake. So why is an apple, like when you're 3-year-old, an apple is super exciting. It's like really sugary. It's really fun to eat. It's crunchy, so why is it better than a pack of crisps with bright colors? So education from the young age and rewards of behaviors from the young age is really important. And we can do that better. So I think like in Europe, this is probably what I would say is like focusing on that and having insurers, governments work together. And the government in Europe plays an important role because when we think of like prevention and business models, often we think of the US, which is a very different beast.
Yeah, and thanks for pointing out those American nuances. And while I live in the US, and thank you for inviting me anyways, I am also a Portuguese resident, so I really appreciate the differences here. And it does strike me because certainly in the US it's a very capitalistic model, which is entirely different than this model. So what you've both described is that cost avoidance, saving money for treatment or therapy or healthcare down the road might justify the need or the money that we spend today on these apps and on this prevention. In the US, we don't make that connection, right? We need to generate revenue, whether it's incremental revenue or not, we need to generate revenue in order to pay for prevention. So I think what you guys are doing here is really awesome. And certainly we've heard some great stuff today about what's happening in Luxembourg and other places. So I'm curious for you, how do we begin to utilize the possibilities of wearables, of more data, of providing more preventative care what's the opportunity in there around reducing health disparities or improving access to care from an equity lens?
Yeah, so obviously I had an app and I was super quantified. So I used to live between London and San Francisco. My lifestyle was a city lifestyle. So, working like crazy, drinking alcohol socially, not eating super well, and doing a lot of sports and being super quantified. So I have an O-ring, my Garmin, my Amazfit, like I was extremely quantified. And again, this is a model that works really well for the US or for the UK. Here we live quite well. And you saw my picture of me surfing. This is my new sport. And when I was wearing my wearables at the beginning surfing, people were looking at me very weirdly because this is not the ethos. Like the ethos in surfing is like you're in nature and it's amazing and you're like in unison with nature. And so when we look at prevention and wearables, it's like, again, I was a little bit stuck in my own company because I stopped using my wearables because my lifestyle was so different, because it was a healthy lifestyle. And so it's really interesting to understand, again, which place we are. And if we are here in Portugal, where people live quite well, but obviously we can live much better, especially for women, it's, again, like, okay, how do we integrate that into the life on the day-to-day? And very often people come to a solution when they have an issue. So here is like, what is the trigger? What is the issue? I love serving women because us women, we have a lot of issues because we have been completely underserved by the medical world, from like having our bones split because doctors couldn't see it before, or having stitches and peeing ourselves for years because we didn't have pelvic floor re-education part of the medical system. So to avoid peeing ourselves, so when we have a woman and she's like, oh, I'm peeing myself, we have an issue, and so we can have a solution. So here we can like, okay, here I can solve things. And this is where the solutions come in, and this is giving access to solutions, to great solutions that solve this. And so for me, the European landscape is really interesting because if we can have the closed loop of governments / public money thinking of prevention, which was your first question as well, better, and can we quantify that? And the answer is yes, we can quantify it because we have so much data. Quantify the financial value of a government putting that money there. Then we can look at like wearables and solutions that are helping our citizens.
Yeah, I think so. Canada is very different from the US. Let's just get that clear. Very different. It's fully publicly funded. And yeah, I think there's an opportunity here for WellTech apps to be more integrated into the model, but they're not there yet. And they're not there yet because I don't think they are being recognized as a way to save the funds, but more importantly, they're not clinically based. Like they have to be evidence-based, clinically based. We have to, or not we, but WellTech, I guess venture capitalists or those investors that are willing to fund these applications will need to show some clinical results in order for the government of Canada to even be able to take them and to include them in the model, in the funding model. But I think your question was about equity, right? It was about how do you not further disadvantage or design in such a way that you're not further disadvantaging those that are already advantaged. And I saw that with the virtual urgent care is if we're not thinking ahead of time, or if we don't co-design and bring those voices to the table earlier in the design process, then we miss the opportunity to design something that's actually meaningful and is going to be utilized by the clinicians, by the caregivers, by the patients. And we miss that opportunity a lot. Like I've worked with so many vendors that, they believe that they understand what problem they're trying to solve. So we roll it out as a pilot and then it doesn't go anywhere. So it's so important to have like that, what problem are we trying to solve? Bring in the right individuals to be able to engage, participate, co-design, and then being able to integrate it in such a way that's like meaningful, and it can create equity. So I think that's...
Yeah, I think those
Yeah.
are both really good points, and you have such a unique vantage point to think about that. And it's interesting to me because we still need so much innovation, and there's still so much that we don't know. I know I've spoken to a few folks that are from startups and incubators, and I've had the pleasure to work with entrepreneurs, startups, venture, PE guys for literally 9 years. And for me, this world continues to change. So I think it's great to believe that there is an amazing idea out there and we just need to germinate more ideas. I think we also have so many things out there, and instead the real opportunities start to identify those that may make the biggest impact and begin to focus on those. Not every idea is going to be a great idea. So really focus on those that are going to blossom and thrive into something larger. How do we really engage our communities around health and wellness innovation so that we can actually make things better for them? Because they're the end user. They're the ones that are going to live there, that are going to receive their care there, that shop there, that go to school there. How do we start to integrate local community members in the population to actually start to improve their own health and wellness? And how do we get those ideas from them?
Yeah, you had a very interesting point on language. So my company, Wild.AI, was only in English, and so we were primarily serving US, Canada, UK, and interestingly Brazil, that has a very similar behavior when it comes to sports to the US, but not Europe so much, because for Europeans it's very important to have a language that is their language. And at the time, translations was not what it is today with AI. And so, first of all, I think language, which you did, you were saying 120 languages.
150.
150, which is crazy.
Yeah, it's crazy.
For Europe, I think it's really important because we want to, especially when it comes to care, we want to talk to a language, it's very personal, so we want to talk to a language that is ours. So having that locally, and then understanding the populations. And in Europe, we have Europe is huge, it's 700 million people. If we have now, there's these new ideas of having a unified European landscape to create companies and to develop companies, and then if we have the language that is removed thanks to AI translations, and it removes the burden from the startups because it used to be a big cost, then we can really have products that are competitive, because competitiveness means you have really good products, but at the same time they're serving real issues, and for a population that is, the population that it is, because my solution, for instance, wasn't a good solution for me living in Portugal because my behavior was just different. So how can we solve products here locally? So, you know, the startups here, you understand the issues of people who live here, and but then also that it's competitive enough that you can either fundraise or have really good revenues. So this is something I've seen, with running Wild.AI.
Yeah. So in 2 of the hospitals that I worked in, we created like a patient and family advisory council to bring the voices of patients and family members. So these are individuals that have had a lived experience, and they were advising us and helping us in the process of innovation. They were also ambassadors in the community. So it was both ways. Because when they were in the community, they were reaching those agencies, right? Like those communities that we couldn't otherwise. But it wasn't just any patient or family member. Like, we went through a very rigorous interview process, making sure that they were not individuals that worked in healthcare, that understood our systems, like really wanted to get that lived experience, capture it. So that part of our design process was to innovate with them, like have their voice. And we've started to integrate that in everything that we do within Ontario. We call it people-centered care. It's one of our quality aims, is to ensure that we have the client, like the clinician experience well-voiced, as well as like the patient, as well as the caregiver. I think one of the speakers was talking about, you know, for every few patients, there's also a few caregivers. So we have to take care of them as well. Especially with aging population, having the voice of the caregiver and how it impacts them. goes a long way. Because in most cases, it's the caregiver that's entering the information, that's accessing the medical record, that's accessing those apps for their family members, for these patients. So I think to be able to design well, I think having various voices, I think it's really important.
And I love how you brought such unique perspectives to that, and I love how you painted the outcomes that we need to get to. So here's our last question for you guys to think about. If you had a magic wand, what's the strategic dialogue that we need to have in our communities? Who do we need to include? And how are we going to know when we're successful?
So in Canada, when we want to change policy around something, so for instance, I work in this organization. It was actually 14 different organizations across the province of Ontario. It was not very efficient how we worked, and we wanted to change policy to come together as one, to create like one governance body to support mobility across regions, because we had, not regions, sorry, like between cities and areas within the province of Ontario. And we needed to bring in the ministry, we needed to bring in like the right individuals that could help influence and change policy on how we provide care across different regions. Because working in various different silos was very challenging. Like you know, we're learning that in some areas we had more social services versus others that didn't have social services. So the ability to come under one governance really made a significant difference in terms of creating space to have these conversations around innovation. How do we think differently? How do we utilize our resources more effectively? So I think that's made a big difference. And working with like the Ministry of Health, policy influencers, policy drivers, so having like a very fulsome approach. So I think it requires various entities to be able to represent, and also agencies in the community. So Indigenous is like an underserved community in Canada, and if we're designing it with them at the table right from the beginning, then we are likely going to be able to serve like in a much more effective, equitable way. So I think bringing like governance and the right teams, not the right teams, but as inclusive and as diverse as possible.
And how will you know that's successful? Are outcomes better? What's improved as a result of that?
So we do measure reducing preventable hospitalization. So preventable, there's a difference, right, between like what you prevent and what you cannot prevent, and it's absolutely appropriate to go to the emergency department. We have outcome measures, we have process measures as well. So the outcome would be that this individual is not going to the hospital, this individual is getting the right care at home or there. We measure days at home, days in the hospital, the time to provide care. There's process measures around how we get coordinators to respond to an individual that's just been discharged from like there's so many metrics that we look at to measure success. Because the data, I think, can drive behaviors. And with AI, like there's just so much data. We're so data rich. So we spend a lot of time doing dashboards and identifying some opportunities and using that as a ground to have those conversations. How do we pivot? How do we change some of these metrics?
Yeah, so I love the concept of the blue zones, which is like places in the world where people live the longest, 100 years old plus. And there's a combination of things like eating well. They do have a little bit of wine because they enjoy time. Loneliness is not an issue. People have local communities, they have purpose until the end of their life. You know, they have like a person who is 97 years old can, you know, be really purposeful and bring a lot of value to the community. And so how do we build that? And for me, that is a big success. And so the question is, like, that is longevity equals blue zones, probably, for me. But then it's like, okay, what is longevity? Probably is not dying, so avoiding to have a war probably is a good idea. So right now, things are going like quite heated. Us in Europe, we don't think war is very sexy. In the US, unfortunately,
Yeah.
I'm glad. And hopefully we won't have that. That is really good for longevity, not dying. So all of us, you know, like being really mindful and really smart about that and having these conversations and not encouraging it because there's nothing sexy about it at all. And then, like, how can we live better and longer? So all these things around longevity, like loneliness, like today, we are all on our phones. People who are, if you take a picture of me, it's fine. But if you are on your phone over there and sending an email instead of listening to me, this is how we include, like, continued loneliness. So how can we tackle not being alone, not doom scrolling on these really stupid social media products, because that is like actually doing harm to yourself. So being nice to your neighbor, bringing like a little apple, if you have apples in your trees. Our neighbors, they all bring us oranges or passion fruits, or a cabbage. It's amazing. And so like this is, for me, this is success. For me, it's like having people who have purpose, all of us purpose, not doom scrolling, not allowing our kids to be on phones, not allowing our grandparents, and having a dinner where we actually look at each other in the eye, have amazing Portuguese wine. This is, for me, success.
Okay. That's wonderful. Thank you both very much for sharing your thoughts and ideas with us. We really appreciate hearing from you. And I know we are all that's standing between you and lunch. So I think we will wrap up. Thank you all very much.
Thank you.